Welcome back, everybody. So good to see everyone joining us again from wherever you may be. We are here. I am here live at the headquarters at 1775 Memphis Street, Hernando, Mississippi, 38632. I hope you guys enjoyed the first half of our open enrollment kickoff telethon and prepare for this and another round of kickoff. We will have more collaborators on this afternoon, as well as more head starts. So we're gonna prepare for them now. Prepare for one now. Miss Hill, are you on? Going to the Delta again. Miss Hill. While we wait for her, we'll go through a video, short video.
Hello, my name is Anise Jefferson. I'm a certified navigator for the Oak Hill Region CDC, Get Covered, Mississippi. Do you know what today is? Well, let me tell you. Today is open enrollment for the Affordable Care Act. You can come here at our headquarters here at 1775 Memphis Street, Hernando, Mississippi. Or you can give us a call at 662-298-3584. But please come because health insurance is important. And if you have lost your coverage or will be losing your coverage at the end of the year, you have from now to January 15th, 2024 to get covered. So come on, today is open enrollment. Hope to see you. Get Covered Mississippi.
Once again, we're going to try Miss Elta Hill and Miss Mary Powell. Are y'all on? Well, I see your names. Just want to see where y'all ready.
Let's see. I'm trying to get my video up. And just a minute, must do.
All right. Also, while we're waiting, we want to make sure that you guys are aware of the OK Regional CDC app. It is free of charge in the Google Play Store and as well as the Apple Store and the App Store for Apples. Please go take a moment to download that. I actually think I have promotion for that. Let me check to see.
No, you my video on the work today. Wait just a minute. You got some? You see me, but you can't get my video. Let me see if I can get the video start. Here you go. It says stop.
All right. Ms. Hill, Ms. Powell, y'all can take it away.
Okay, but you can't see us.
We see you. We can see you.
Oh,
We
you
can
see it? Okay. Hello. Lisa. Hello. You got this from the Delta. It's Dr. Manning said you got Batman and Robin. But anyway, my name is Alpha Hill, and we are so happy to be here today because this is open enrollment today. We are so glad to be here. November the 1st. Oh Lord, what a day! Last time, and I think this is my 3rd year in this year. And when we're talking about open enrollment, we just love to see the excitement on people's face when we talk about they can get some health insurance. Oh, yes, Medicare. But I'm going to introduce Mary. Mary is going to take it, and I'll come back with a few things. Get covered from Mississippi because it's open enrollment today. Hello.
Before you get started, Ms. Powell, before you get started, we're on your phone. Your video is on your phone. That's where we see you at.
Okay.
So if you could turn the volume down on your computer and just speak from the phone so we can see you guys.
We got the video. Turn this. I'm trying to make the volume go down. Hello, we're excited about open enrollment today. This is my 2nd year participating with Oak Hill Regional.
Last year, we had many success stories. We were able to sign up a young man who was due to have surgery in January, found out in November of 2022 that he needed open heart surgery. And so we were able to get him enrolled in health care coverage. And I think around January the 7th, he was able to have his valve replaced. And that was just such a great success story. We were able to help him covered. And that's what this is all about, helping the residents of the state of Mississippi receiving health care. In addition, throughout the year, we've been able to help different individuals obtain health care, preventive care, dental care. I met a young lady who offered insurance, had insurance through her job, but it was very expensive and she couldn't afford it. And so we were able to get her covered through the marketplace, through the ACA, and she paid a portion of what she was paying through her employer. That was such a great success story. She was able to save money, and it's just been wonderful.
We have another successful story. That was a young man had never had any dental work at all, and then he got a chance. He said he was having a problem with that, but through healthcare.gov, he was able to get some help to get his whole mouth fixing everything without no whole cost of that. And those are some success stories. We can go on and on.
And so it really is true. We work together, and we are a Batman and Robin team. And we want to get the residents of Mississippi covered so that they can have affordable health care, preventive health care. That's what it's about. We enjoy doing this, enjoy helping our neighbors and different individuals that we meet throughout Sunflower County, Bolivar County, LaFleur County. It is just a joy to be able to serve.
And if y'all need us, call us at 666-662-928-3584. And we don't want you to, but don't miss the affordable care, Obamacare, open enrollment. If you say yes, we are here for you. Get covered. And then our special enrollment period, our Medicaid and CHIP for our children. When I get off of you, I'll be able to go and find where I get them. But this has been a rewarding thing for us to be working with open enrollment, working with and all of this stuff. You find so many people that don't have health care. And when we sit down and talk to them and tell them what they can afford, they be so excited about it. Oh, yes.
So we just want to encourage everyone to continue doing the work that we do. We're so thankful for this great opportunity. Because Mississippi, the state of Mississippi is pretty much on the bottom when it comes to healthcare. And it is such an honor to be able to minister and to serve and to help those who are in need to be covered, to have insurance that normally they would not be able to receive. We're just happy and excited about this open enrollment starting today through January 15th of 2024. So we want to encourage everyone, get covered, Mississippi.
Get coverage. Get coverage. And you can always reach us. We're here to help you. And we met some couples that they thought that we had to get paid to help them. We told them we was a nonprofit organization. We don't charge for that. And they were so excited. Now my phone, we hope you heard you. I hope we have said something because I know my computer's acting up. but we had to do something for Mr. Duke. We tried to do the video, but the video didn't come out. But anyway, we just want everybody to stay encouraged. And we know what this year is, and I'm gonna throw a little bit of I'm gonna put a little bit of politics in here, just a little bit. Just remember, November the 7th, go to the poll. When we can expand our Medicaid. And
Thank you so much for allowing us to share this time together. We're just, like we said, we're just excited. This Batman and Robin team is ready to go to work.
Thank you for that, Ms. Powell and Ms. Hill. We have a question for you guys. Which one is Batman and which one's Robin?
you know I'm Batman. And you know Mary Robin.
I'm just happy to be a sidekick.
Thank you guys so much for that.
Thank you.
Thank you. Listen, Duke.
All right, thanks for that for the ladies that's out down in the Delta, the Batman and Robin, Miss Hill and Miss Powell. Um, let's go to our websites. Let's share about our websites. I'll take a moment to walk you through our website. As they all know, the number to call us is 662-298-3584. You can text us at 662-689-9712. This is our website right here, everybody. And of course, we're advertising the open enrollment kickoff telethon, which is from 9 a.m. to 5 today. We have flyers here for you to download. Of course, we have the video that we shared earlier about our 10-year anniversary, and it all began August 21st, 2013. What started out as several Mississippi Delta counties turned out to be, we started covering the entire state of Mississippi, the entire 82 counties. And right below that is where I was talking about earlier about the app. If you go to our Get Covered website, you'll be able to scroll down to this section and you can click here to download, and it'll take you directly to the Apple Store or the Google Play Store to download that app, which is free of charge. Also, let's scroll back up and we can find out more about what is Get Covered Mississippi. Get Covered Mississippi is a statewide faith-based coalition focused on raising public awareness and engaging consumers about health coverage options available through Affordable Care Act, Medicaid, CHIP, Medicare, and fairly qualified community health centers, and promoting the importance of health and wellness and promoting the importance. Wow, that's a double type. I'll make sure I correct that. Vision. We see a day when Mississippi will be one of the healthiest, most healthy insured states in the country. Our mission, we're committed to encouraging healthier lifestyles and creating healthier communities. We will achieve this vision through outreach, education, and inspiration to our fellow Mississippians. Our goals, number one, rally the grassroots to help create healthier communities for all. Number two, connect Mississippi consumers to the right resources and information so they can choose health coverage options that's right for them, their families, and their budgets. And our last goal is provide ongoing support to enable people to eat smart and move more. Below here, we have our leadership team, our executive director and grant authorizing official, Dr. Michael O'Miner, our project director, Mrs. Lottie Miner, our lead navigator, Mrs. Berta Taylor, our financial administrator, Mrs. Anise Jefferson, Mr. Thomas Robertson, who is me, is the technology and metrics director, Ms. Bettina Campbell, special populations administrator, and Mr. Clarence Campbell is the educator coordinator. Get Cover Mississippi, where we're all about, whether it's online or in person, we just want to have a conversation with you. By arming you with the facts, we want you to feel confident when it comes time to make the best health and wellness choices for you and your family. A big question that we get a lot of the time is why are we working with Mississippi's federally qualified community health centers? Since some Mississippians applying for coverage might not qualify for a subsidy and or Mississippi Medicaid program, we have been working with our state's FQHCs to help our fellow citizens find a medical home. These centers offer services on a sliding fee scale based on income. We continue to make referrals to those FQCHCs, and we will hear more about our federally qualified community health centers around the 2:30 mark. We will hear from Aaron E. Henry. And below, we have our region map. We showed this earlier, shared this earlier with you guys to tell you we are branched into 10 different regions across the state of Mississippi. And just give us a call and we will refer them to whoever may be close to you that's in your area and you may want to meet at a library or something. And just give us our office a call, 662-298-3584. I can't stress that number enough. And if you don't want to call, you're more than welcome to text us at 662-689-9712. Our collaborators, Henry Community Health Center, Service Center, Boat People SOS, Catch Kids Tupelo, who you heard from earlier, East Central Mississippi Regional CDC, Mercy Housing and Human Development, Mid-South Churches Cooperative Conference Baptist State Convention, and National Faith-Based Mobilization Network, which is Faith MoNet. I also have to stress the importance of the Navigator Privacy Notice and the data collection and tracking. This agency receives funding from the Center for Medicare and Medicaid Services to provide enrollment assistance to Mississippians using the health insurance marketplace. This funding gives Oak Hill Regional CDC and Mississippi legal authority to collect and track personal identifiable information of the people we assist. The purpose of this information collected is to help document the use of the Affordable Care Act marketplace and report the number of characteristics of those assisted to our funder. The information we collect from you will be disclosed only to the grantee, its subgrantees, and healthcare.gov, and only for the purposes of reporting as required by law. None of your PII will be shared outside of Oak Hill, and all our reporting completed will include aggregate data only. So none of your PII will be shared with anyone other than the agency with which you provide it, and that is Oak Hill Regional CDC and healthcare.gov, who will use it for reporting purposes only. Refusal to provide information will not constitute a denial of services. We only collect information that we consider to be appropriate. The collection and the use of all personal information are guided by strict standards of confidentiality. A copy of our privacy notice describing our privacy practice is available to all consumers upon request. So that is very important information for you to know about Oak Hill Regional Community Development Corporation. Moving right along, I want to advertise about our Ask Mary and Pat show. That is every last Monday of the month. Our next one will be, let me pull out my calendar, will be November the 27th. And that will be the last Ask Mary and Pat show for the year. And we will start again back in January. If you have any questions about Medicaid CHIP, please go to our question box and you can ask any questions that you have as it refers to Medicaid and CHIP, and they will get you covered through the Medicaid and CHIP. Of course, we have our share tab. Get Cover Mississippi adopted the National Faith-Based Mobilizations Network Share Substance Abuse Prevention, Education, and Outreach Initiative. It's focused on illicit drug use, opioid abuse, and alcoholism. SHARE stands for support, healing, awareness, reconciliation, and education. If to learn more about that, you're more than welcome to come to our share tab and just look at the different pictures that we have, flyers, facts, and share in your communities. Also, we want to tell you guys about the inquiry form. If you are out and you see our QR code, you're more than welcome to fill out the inquiry form and someone will contact you. This form takes maybe anywhere to 2 to 4 minutes to complete. Very, very simple. You can click the interests that you have for the health insurance options, select all that apply, and we ask you, may one of our representatives contact you, the best time to call, and what event did you attend. If you didn't attend an event, you could put NA. And if you want a specific person that talked to you to call you again, put their name in the who assisted you. And we also love to hear, how did you hear about Get Covered Mississippi or Oak Hill Regional Community Development Corporation? Also, I want to promote about another monthly event that we have, and it is the third Wednesday Parent Resource Chat. Uh, we share vital information as it relates to education, health and wellness, child development, mental health, child dynamics, bullying, and so much more. It starts at 11 a.m. every third Wednesday of each month, except for July and December. So join us November the 15th for the last third Wednesday Parent Resource Chat of the year, and we will start again in January. And November is about self-care during the holidays. And that concludes our website. And if you have any questions, please let us know. Drop the questions in the chat. Once again, we're here today from 9 to 7. You're more than welcome to fill out this contact form as well, and just find out more valuable information as it relates to Get Covered Mississippi.
I got into tattooing as a teenager. I was really drawn in by the culture and the art that was associated with it. My name's Skylar. I live in Indiana. I'm a self-employed tattoo artist, and I was able to find affordable healthcare through healthcare.gov.
Something cute like that?
I do use my health insurance. I use it quite often, actually, because I wanted to make sure that not only was my physical health taken care of, but also my mental health as well. All right, you ready? I just wanted to make sure that I was covered, not just for now, but for in the future and any emergency care that I might need. If I got COVID and I needed to be hospitalized, I know that I wouldn't have to worry about being charged a lot of money for it. As a self-employed tattooer, nobody was offering me insurance. I had to go myself and look for insurance, and healthcare.gov helped a lot with that. It allowed me to look at all of the insurance plans just right in one spot and compare them and see what was best for me. It made the process so much easier. I think that people should know that it really is a lot more affordable than they think it is. I think that if you just go and take a look, even just for a few minutes, you'd probably be very surprised at just how affordable some of the stuff could be.
New law, lower prices. More people qualify. Final deadline is January 15th. Healthcare.gov. Produced by the U.S. Department of Health and Human Services.
Again, I am back, and I'm going to introduce our next navigator, and it's also a collaborator. Bring her on the screen, promoting her to a panelist now, so she can tell you more about her work through the Affordable Care Act. Hey, Lakedra.
Hey, can you hear me?
Yes, would you like to share your video?
Um, you want to just see me because I'm sitting at my desk.
Yes, that's fine. We can bring you on
O-
camera.
Okay. So do I join as a panelist?
Yes, ma'am. All right, let's turn it over to Lakeisha Giles and the Aaron E. Henry Community Health Center.
Okay. Good afternoon, everyone. My name is Lakedra. I'm a navigator here at Aaron E. Henry Community Health Center. I currently work at the Batesville, Mississippi location. So I'll go over a few services that we offer. And also we have other locations. We have the Clarksdale, Mississippi location. We have Coldwater, Mississippi, Tunica, and also two school bases, which is Quitman County and Kahoma County school base. So here at Aaron E. Henry, I'm the navigator. I've been here for about maybe 9 to 10 years serving as a navigator. I started off as a CAC, so now I'm the navigator. So here at Aaron E. Henry, we have a wide range of services that we offer. We have behavioral health care, diabetic foot care, drug screenings, chronic care management. We do COVID testing whenever there's a patient in need. We also offer COVID vaccination, but right now we don't have any at the moment. We offer exercise therapy, which is located in Clarksdale at the Aaron E. Henry Administrative Complex. We have optometry where they offer eyeglasses and also contact lenses. We have we do HIV screening because we have a round right program here. We have one here at this location, Clarksdale, and also Coldwater. But I think all of the services are offered at all the locations. We also do immunizations. We have internal medicine. We have an internal doctor here, which is Dr. Cummins. We offer mobile health services. So we do have a mobile unit, which goes around whenever they're needed. We offer nutrition. I think we have a nutritional counselor at the Clarksdale Clinic. We also have a dentist, but we don't have a dentist at the moment. They're currently looking for a dentist. So right now we don't have any dental services. We do pharmacy because we have the 3O 4B program. We have Dr. Crane. She's over that program. So if you know of any patients who need any kind of discounted medications, they can come here. They just have to be seen by a doctor. We have public transportation through DARCS. So DARCS is located in Clarksdale. You just call down there. You know, if you have insurance, they'll schedule you to take you around to, your doctor appointments. We have social services. We have a case manager here, and also I'm a community health worker here as well. We also have a licensed clinical social worker, so she does therapy for anyone who's in need. But she's located in the Clarksdale Clinic. We offer telehealth services, sports physicals, WIC certification, and also women's health. So we do PAPs, we also do birth control, and also the depot shot. But you just have to bring your own medication if you need a depot here at the Batesville Clinic. Let's see. And we offer the outreach and enrollment at all the sites. I'm the only navigator here, but we have trained some new counselors at the Batesville, Clarksdale, Coldwater, and Tunica site. See, we do drill trainings for anyone who's in need. We do all types of physicals, but we do not do the DLT physicals. See, am I missing anything? Does anyone have any questions at the moment?
Any questions while she's on here? Even our attendees, you're more than welcome to raise your hand, ask any questions. We'll open your mics. Check.
I have a question. For instance, at all the other centers, do y'all have a listing of the services they offered at the other federally qualified health centers?
You said right here at Aaron E. Henry?
No, at any of the federally qualified. Like sometimes I will call, but do you have like a general listing of which centers offers what type services?
No, I only have the services we offer here at Aaron E. Henry.
So then consumers should just call that site, right, and just find out.
Yes, they can just call here. Like we have a main clinic Clarksdale, but they can call in if they're trying to find out about different services.
And that's going to be located, the information is located on our website too, right? Like what the centers on. Okay. Just want the consumers to know if they log in to Get Covered Mississippi, they can find a fairly qualified health center.
Yes, they can call my site or they can call me and I'll help them because I schedule as well or anything they need.
That's great. That's great. Thank you.
You're welcome. Okay. Is there any more questions? Trying to see if that's everything I have been over.
Any attendees have any questions, more than welcome to raise your hand to ask any questions. What's a good contact number to call you if they have any questions?
Okay, so here is 662-563-4292. But if they want to call like Clarksdale, if I don't answer, it's 662-624-4292. But I also have let me see. I think I have a direct line. I have a different, let me see, phone number than everyone. Let's see. Trying to. Your call cannot be. I was trying to, but yeah, they can call and ask for Lakedra. I was trying to find my direct because I have a different phone number. Let's see. It's not showing. But yeah, they can call those two numbers if they have any questions or if they'd like to speak with me. And my extension is 5502. Let's see if I went over everything. And we service Coahoma, DeSoto, Panola, Whitman, Tallahatchie, Tate, and the Tunica counties.
Thank you so much, Lakedra, for coming on and sharing valuable information for Annie Henry. If you guys have any more questions, please contact her. What's that number one more time?
Okay, so let me go back over the Batesville number. It's 662-563-1858. That's Batesville, and my extension is 5502. If they'd like to call the administrative complex, their phone number is 662-624-4292. And that 624 number, they'll direct you to wherever you want to go. But the Batesville number is my number plus my extension.
All right, y'all heard it here first. Thanks so much, Lakedra.
Okay, you're welcome. Is that it? Okay. All right. Thank you.
All right, we have our next navigator on, Mr. Clarence Campbell. Brother Campbell, it's in your hands. Make sure, Mr. Campbell, can you hear me?
Good afternoon. How are you?
Is something going to go on your show? Mrs. Campbell, can you hear me? All right.
Yes, I can.
All right. It's on you whenever you're ready to share.
All right.
Sir,
No.
do you have insurance?
Okay.
Do you have health insurance?
No, no.
Are you employed?
Yes.
Okay, are you interested in that?
Let me also come back. I'm trying to print these paperwork court really.
Okay.
Okay, thank you.
Okay.
Okay. All right, we're on. Okay, Duke, are you able to hear us and see us?
Yes, sir.
Okay. Bettina?
Good afternoon, and I have some breaking news for you. Clarence and I are here today at the M.R. Davis Library in South Haven. We are kicking off the opening of the 2023-24 enrollment for affordable care. So why don't you come on down and let us sign you up, or if you have questions, we can ask questions. This is the third year that we will be here partnering with the library. They've proven to be excellent partners. And we just want to make sure that as representatives of Get Covered Mississippi, and we want to make sure that all of our residents in Mississippi have health care, because it's so vitally important for not just your children, but also the parents to be signed up and to be in good health, because good health, believe it or not, plays a part in whether or not you have good finances. So come on down to the library here in South Haven and talk to us about the possibility of getting some health insurance for you and for your family.
Okay, this is Clarence Campbell on behalf of our team, and just have key points to remember. Let's see if I can get into sharing screen again. Just remember, the marketplace is a way for qualified individuals and families to find and buy health insurance. Reminder again of our open enrollment period from today, November 1st to January 15, 2024. If you want your coverage to begin on January 1st of next year, you need to enroll by December 15. And you can call us at 662-298-3584 or text us at 662-689-9712. You can get us at these numbers just about anytime, normal business hours. But if you'd like some information today, or maybe want to see about getting signed up today, you can come on down to the M.R. Davis Library here in South Haven, and we'll be glad to get you signed up today. Thank you.
Everyone wants to-
Thanks for that, Brother Campbell and Sister Campbell. It was really good at how y'all were interacting with that one gentleman that just walked by. Y'all are on it.
Okay, Duke. Yeah, that's what we do here.
We are here and might as well try to catch them as they're going out the door or coming in the door, because sometimes they stop and they look and they just stare and they're afraid to ask questions. So if you invite them to come on over to the table and talk to you, they will. It's important. Sometimes people don't realize, or they think that they don't need insurance. I'm healthy, and so I don't need insurance. And then when something happens critical to them or to their family members, and there's no insurance to pay it, they find themselves in a world of debt. A lot of people have lost their homes because they get in so much debt that they can't afford to pay the debt, so they end up in court and having to either sell their home or just sign their homes over because they don't have the money to pay. And it's so unfortunate when there's such good programs like the Affordable Care Act and like the Affordable Care Program, the Marketplace, and also like Medicaid or Medicare and CHIP. And then there are other types of insurance that benefits veterans. So are other occupations. So they should come and find out what their options are. Now, we just primarily work with affordable care here. And also we can make referrals to you for Medicaid and sometimes Medicare. But we can also tell you how to contact these other organizations. And even if you're just across the border and just across the state line in Tennessee, and you're here visiting this library for a purpose, come on over and we can tell you how you can get in touch with the Marketplace assisters and navigators in Memphis, Tennessee. So.
And one thing I wanted to tag on to what Bettina said about the financial burdens sometimes that are brought on by medical bills. That's one of the major reasons why families, individuals have to file bankruptcy, is because of they accrue a large medical bill that they're unable to pay off. And so the time to get the insurance is beforehand. And one of the things about the Affordable Care Act we like to emphasize is you cannot be denied coverage because of pre-existing conditions. So if you have something going on and you need to get it taken care of, then if you don't have insurance, you need to get signed up and get a plan, get some type of plan.
And whether you have something going on or not in terms of pre-existing conditions, sometimes we don't have something going on and we don't even know it. For instance, I'm going to personally disclose the fact that in 2003, I was diagnosed with cancer. But guess what? It was when I felt like, for me, it was the most healthiest time in my life. I was running, I was eating right, I was sleeping right, I reducing my stress and doing all of the things that they say that we should do to be healthy. But guess what? When I went to have my annual mammogram, unbeknownst to me, there was cancer there. And so now it's too late for me to go try to get some insurance, but thank God my husband was working and I was working, and we had really wonderful insurance at that time. And so I was able to go and get it taken care of. And 20 years later, I'm here to say that that was one of the best things that could have happened to me, is the fact that when I did need it, the insurance coverage, I had the insurance coverage. So just because you don't think that you need it, you think that you're healthy, does not mean that you don't need to get the insurance, because guess what? Now you can go do the prevention screenings and make sure that there's nothing wrong. And you don't have to worry about, where am I going to get the money to pay for those screenings, because they are expensive. But if you have insurance, then you can, and you and your children, your husband, your wife, you can go at your daughters and sons and if you're taking care of your grandchildren, you can go and get signed up for insurance, and then you can go and you can get the preventive care that you need.
And earlier today, other representatives spoke about deductibles and co-insurance, money that you have to pay out of pocket before certain procedures may be covered. But with coverage through the Affordable Care and most other qualified health plans, we have the preventive services that are covered at no charge before your deductible is paid. Right now we have getting ready to go into the flu season, and there's also another couple of bad viruses out there. There's RSV, there's of course coronavirus, there's pneumonia, and so there are vaccinations that are available for you to take that can help protect you against these viruses. And again, these are things that are covered without charge to you if you have insurance with a qualified plan.
So again, we're going to tell you, we're right here at the South Haven Library. Come on down and get signed up today. Or if you just have questions and you want your questions answered, come on, sit down and talk to us. We'd be happy to provide you with the information. And if you think, well, maybe I'm working, but I don't have insurance, but I'm working, so I don't know if I can even afford it because I'm not making that much. Come see. Let us tell you no, or let the marketplace tell you no. Don't just assume no. And if you already signed up, and you need to sign up again, because the pandemic is over, and maybe you were signed up during that time because of that. So now you need to check it. You probably got a letter, if you're like me. You looked at it and said, it's not important, and you threw it in the trash. Or you just didn't bother to open it. Or you got a phone call and you didn't recognize the number, and so you didn't answer it. Now is the time to find out whether or not this applies to you, whether or not you're going to lose your health care coverage, or your child is going to lose their health care coverage. So come talk to us before it happens.
Okay. During the pandemic, we had what was known as a public health emergency. And during the public health emergency, people that were able to obtain Medicaid coverage, they did not have to go through the annual redetermination process. Also, people that were on Medicaid who would have aged out at age 19 did not age out at 19 during this public health emergency, but the public health emergency ended in April, and now states are purging the Medicaid rolls of people who have aged out, people who did not go through the redetermination process, submitting income statements. And then there's a number of people that may have gotten Medicaid coverage that did not realize that they actually had to go through this annual redetermination process. And as Bettina mentioned, they may have gotten letters and they ignored the letter, they didn't see the letter and whatnot. Then they go to a medical provider and take the child there, and they find out that coverage is no longer in effect for them. And so they have to jump through hoops to try to get back on the Medicaid rolls. And in some cases, where the person has aged out, they're older than 19 years old now they have to obtain coverage from another source, such as either coverage through an employer or possibly through the Affordable Care Act, which is, again, what we do here.
Thank you so much, Campbell family. Y'all do such an amazing job as always.
You're welcome. It's our pleasure.
All right, we're gonna move on to our next presenter. Let's check. Jane, are you there? Boat People SOS. All right, while we're waiting on them, we're gonna share a short.
Hello, Boat People SOS. I'm so sorry.
No problem. You go right ahead, Jane. How are you?
Good. How is everyone?
We're all good. We're excited about open enrollment.
Let me. Hi, everyone. Okay. I apologize. I am trying to get my screen on. So our team from BPSOS, Boat People SOS, has been doing great work in enrolling people for the ACA for years with Oak Hill Regional. We're here to help navigate the ACA open enrollment process. The open enrollment period for the ACA allows you to sign up for health insurance and make changes to existing plans. It's important because it provides coverage and options for people and their families. And it's the best time to make sure that everyone has the right plans for them and their needs. BPSOS and Oak Hill Regional's collaboration has been extremely crucial and a crucial part of our outreach and enrollment efforts here in Mississippi. We've been providing information and assistance to all the communities in Mississippi. And usually we let people know to enroll. They can start by visiting healthcare.gov or our state's health insurance marketplace. And they'd be able to find the information that they will need there. But usually if they have any questions or any kind of language assistance with their application, we always invite them to come by our office. And there are times that we'll go out into the communities, into their homes and assist them, or at locations that they feel safe to meet at to help them one-on-one. You know, our bilingual staff here at Boat People SOS is very well trained in helping the community with the ACA enrollment. We've been, like I said, been doing these for years with, thankful for our partnership with Oak Hill. You know, I think you can always begin, if there's anyone out there that's, you know, needing language assistance, especially the Vietnamese community or any kind of Asian Pacific Islander community that you know of, or little pockets of it within Mississippi that need our assistance, they can contact BPSOS in Mississippi through our phone number 228-436-9999. They can always go to our website, bpsos.org. There is an info and contact messaging bar that you can reach out to us, and we respond in less than 24 hours to those email messages through our website, as well as through Facebook Messenger. We're on BPSOS Gulf Coast on Facebook, and you can message us and have a response within 5 minutes. So not only do we have a team that's ready to assist with any questions that the community members may have about ACA eligibility, the application process, we can also help the community understand the various health insurance plans available and determine which one best suits their needs. So we're here to make the process as smooth as possible for everyone and their families. Do not hesitate to call, reach out, or to ask us any questions. And, you know, we're just taking great steps to ensure that everyone's family, health, and well-being is at the forefront. As well, I don't know if anyone's familiar with Boat People SOS. We do a lot of the ACA related activities within the state, BPSOS Gulf Coast. So we conduct outreach, educational efforts to inform immigrant and refugee communities about the availability of ACA health insurance coverage, important enrollment deadlines, and the benefits of having health insurance. So you know, we also provide enrollment assistance to individuals and families seeking it through the marketplace online. And we also provide a lot of language and cultural support. And that's what we usually do along the Gulf Coast. Keep a lookout for our community workshops and events. We have them throughout the year, not only just through the enrollment season, but throughout the year, we're always providing outreach and support for the Affordable Care Act enrollment. And I think that's about what we have. I don't know if I was missing anything else, Duke.
You did amazing, Jane. I really appreciate you for coming on and telling the world about Boat People SOS.
Yeah, we're always appreciative of Oak Hill Regional and our partnership, Dr. Miner and everyone there. You guys are such an awesome team. And, you know, we're just grateful for everything that you guys have provided us, also all the support, ongoing support that you've given us over the years, so that we're able to provide all this assistance to our community.
Thanks again so much. We love having you guys a part of Oak Hill Regional CDC.
Me llamo Mario con Get Covered Mississippi. Yo soy un navigator para ACA y Open Enrollment 11 empieza hoy, 1 de noviembre. ¿Todavía tienes seguro médico? Si no, esta es oportunidad para obtener un seguro médico para ti y tu familia. Si estás en el DeSoto County, ven a nuestra oficina a 1775 Memphis Street, Hernando, Mississippi. El número es 662-298-3584. Open enrollment termina el 15 de enero, entonces obtenga cobertura hoy.
It's open enrollment, November 1st, 2023. And I bring you greetings from the Mid-South Church's Cooperative Conference State Baptist Convention, where Dr. Michael O'Miner is our president, Bernard Montgomery is our vice president at large, and Phyllistina Albrighton is our general secretary. I am Loretta Miller, I'm a navigator, and I'm ready to assist. Simply come by our location or give us a call, 662-298-3584, where we can assist with your application process, answer questions should you desire. Or you can simply go to www.healthcare.gov to begin your process. Yes, today is open enrollment. This is open enrollment number 11, and it will be available for you until January 15th, 2023. If you want your insurance to begin in January, on the first day of January, you will need to have your premium paid by the middle of December, December 15th. However, should you decide to have insurance by February 1st, you only need to have a plan selected and paid by January 15th. There are some other specifications that you might need to know about. When you visit www.healthcare.gov, you can go in, complete your application, put in the number of people in your household, your income, your location, and choose plans. Or you can just window shop. Go in, select your location, where you are, your zip code, city, state, and then you can just window shop. You can compare plans. You can see which plan has your doctors, your very specifics, such as your specialist, if you need one. But the option is yours, www.healthcare.gov. If you need assistance, give us a call, 662-298-3584. Otherwise, the plan and the website is open 24 hours a day for you to take your time and select the plan just for you and your family. It's all based on income, so you might want to put your information in and determine whether you have qualified for APTC, a approved advanced payment tax credit, or look for some of the other cost reduction savings that are available for you on the marketplace. And again, if you need assistance, give us a call, 662-298-3584. We are ready, available, and willing to help. Thank you, and look forward to either seeing you, talking to you, or just having fun during this open enrollment period. Thanks.
while we're waiting for our next presenters, we do want to keep you guys aware of the 10 essential health benefits: ambulatory patient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative services and devices, laboratory services, preventive and wellness services, and pediatric services. Those are all covered under the Affordable Care Act. Make that aware. We call those the 10 essential health benefits, and they are covered under all healthcare marketplace plans. Now we're going to go to the capital of the state where Dr. Tally is. And I'm going to bring her up, and she has special guests with her. Special guests, Dr. Lisa Buchanan and Miss Linda Seals. Miss Seals, if you could accept that panelist invite so we can have you speak and also see you.
Good afternoon. My name is Marion Talley, and I'm, in addition to being the associate minister at Fair Street Baptist Church in Jackson, Mississippi, I'm a navigator with Get Covered Mississippi, and I've been a navigator since 2017 and work with almost 300 consumers, and I am just really happy about our open enrollment right now. I am considered the navigator and the director of the Affordable Care Office at our church, and for the Metro Jackson area, for Clinton, Ridgeland, Byron, and other surrounding areas and towns. And we are available to help. While you can always get started at the marketplace, we are available from 10 o'clock to 8 p.m. Monday through Friday. And all you need to do is to call us at 601-990-6896, or you can email us at mtally@oakhillrcdc.com. Now, the affordable health care open enrollment, we know by now, you know, that it's starting the dates of November the 1st, 2023 to January the 17th, 2024. And of course, the marketplace applications If we have completed them by December the 15th and everything is complete, your coverage will start on January the 1st of 2024. Or if applications are completed between December the 16th and January the 15th, then your coverage will start on February the 1st of 2024. We are available as navigators to work with you to complete your applications for the ACA health insurance and for Medicaid. And as a matter of fact, we do have a unit here of trained professionals to work just with Medicaid. Now, coverage could be more affordable than you think, and there's a possibility to receive financial help. You may have heard the good news that you may now be able to get premium tax credit, and that is credit to lower your current monthly premium. Although your premium may come in, and if you look at it, it may be one amount, that premium tax credit goes directly to the insurance company, and it will lower the amount you have to pay. Last year, 9 in 10 Mississippians qualified for some kind of financial help or premium tax credit. And for most people, that meant many could find premium, some even as low as $0 per month, and many around $20 or less per month. Plans then through healthcare.gov cover, as you just heard, 10 essential benefits, including behavioral care and prescription drugs. And an insurance company cannot discriminate if you have pre-existing conditions, or if one of those conditions is something that you have been covered with before. Now, free help is available. We are available. Our services are free. And if you have questions about signing up or want to talk through your options, there are several companies that are with us today with a trained professional, then we're just a call or a click away. As we said, the Medicaid coverage is available. We have a special unit, and that is not subject to the open enrollment. You may get Medicaid year round. You may qualify. And of course, we look at the Medicaid and CHIP as special things that children might need. Medicaid, of course, covers checkups, dental visits, eye exams, vaccinations, prescriptions, hospital visits, mental health services, and much more. And of course, there is a way, and there are things that kids really need. There should be no reason why any child does not have health care or will have any trouble whatsoever in terms of needing services. Now, you may always go to healthcare.gov to start your application. However, if you are working with me, the first thing you're going to find in the Jackson area is that we're going to give you an appointment card. And that appointment card comes after our initial talk. It'll tell you what time and what we're going to do. It also tells you that we will be possibly calling you over the phone, so that when you see the number, you won't get said, I don't want to call, I don't want to talk. This may be somebody else calling me, so you will know what it is. We also tell you about the consent form, and we tell you whether or not, if you cannot scan this consent form, or how to print it and to get it back, because we must have that form. Now, the consent form is something we are required to have before we can work with you. And that is so that the consumer knows that although we're aiding you and we have to get personal information, we are held criminally liable if we disclose any of your information. And the consent form is what we give you, and we have you sign, and we have you go through, so that you will know that we are criminally liable if we would disclose any of your information. Now, once we have finished and we have gone through our appointment and we have taken care of, and you've selected your policies or the insurance that you would like to have, the health insurance you would like to have. We can also help you in making sure that the insurance you select will be your doctors are covered and the hospitals that you attend are covered. We can make sure that the medication that you're taking is covered. And we can do all of that as we're working with you in selecting your policy. The last thing we do is we want you to know that we appreciate you working with us. And so we always send you then a thank you letter saying thank you. But in addition to that thank you letter, if we have worked with you on the phone, the first thing we do is to make sure you can get into your healthcare account yourself at any time, 365, 24/7. We also make sure that we send you copies of all of the documents that we have worked with you on, and so tell you how to set up a file so you will have that particular material and that documentation so you will know about your policy and what you're doing. Now, we work at Ferris Street Baptist Church. Our office is set up in there. However, we do a lot of work over the phone virtually. And so we may either go into the office or we can work with you over the phone. Right now, most of our consumers would rather, we think, work over the phone, but we can work and we do have office hours by appointment. We try to participate and to give out information in the community. One of the things we have done is we participate, for example, in the Martin Luther King Parade. And here we participated in the Juneteenth celebration at the museum and so forth, so that we try to get out and give information in as many places as possible. There is also yearly training. Here is Sister Teresa, here she is, bless her heart, from HHS, and that from CMS, and that here we have all of the navigators from 1 year, from these are two different years, where we have the navigators who we trained, and they just so happen to have been at Ferris Street for our training. But we have every year, we have yearly training in addition to the online training we have to go through to be certified. We do have training to be certified by HHS, and we have to pass those tests to be able to be qualified to even work with you as navigators. We have gone out to nursing homes and work with them. We've gone to businesses. We've had individuals have even companies coming into the office, sitting down, working with us to get employees certified and with health insurance. Because Jackson is so large, we have just a large area. We were able to go out to the housing authority and work with individuals coming into the housing authority. This is from a health fair. That's a gigantic heart back there that we were setting up to work with, and that so that we're able to go out, and we go out to different events to be sure that we're able to pass out the information and that we can sign up individuals there. Here we were at the museum, and we were here at the opening of I think a Juneteenth festival and so forth. Here we were at the state Baptist convention function, and we were able to work with and were able to then pass out information on both ACA and Healthy Kids and Medicaid and CHIP. And here we go. And then I have just one announcement I would like to make. I would like to invite you all to, I'm also Church Women United, and we are having World Community Day, and we will be talking about health and wellness at this affair And the Health and Wellness Affair is going to be on the 3rd of November at New McRaven Hill Baptist Church. And so we invite you to that. There is a reception afterwards, and we will be honoring Evangelist Lorraine K. Bishop as our valiant woman. I would now like to bring on for a testimony one of the young ladies that we have worked with, and then she will introduce one of her staff members. So we have Dr. Lisa Buchanan.
Thank each and every one of you so very much for this opportunity just to speak with you today. I mean, I am without words in regards to what the ACA have done for me personally, as well as just helping others, because I believe that's what that extended hand is. I did not realize that I was going to be in a position, because when I was first approached with this, I was a navigator myself, and it was so interesting just to see and just to be able to reward and just to help other people. But I came to a position where I didn't have insurance myself and needed to use the services for myself. And I have been a participant in regards to that ever since 2021. And like I said, it is so helpful, and it's so, it goes without words what it has had benefit me in my life, just to have insurance, to have dental insurance, have to have vision insurance, and then have health insurance, because I did have some pre-existing conditions, and it wasn't any hassle, it wasn't any kickbacks, it wasn't any, I was able to be linked up to the services and use it accordingly. And so I want to thank Dr. Talley, because she had some office hours, but yet and still she stayed on that line until I was able to get that insurance. And so, and also I do want to introduce Miss Linda Seals to also have a testimony. And that's one of, I always say, even though that's in my employees, I always say that's one of my coworkers, because I feel like we just that close. Because when you have great information, it's so prevalent that a lot of people like to pass on bad information. But when you have something great and good about it, I believe you need to share it with other people. And hopefully, even as a team that we are at this agency in Jackson, Mississippi, we are trying to incorporate where we can even get our clients covered, because we have a lot of clients, probably 99.9% of our clients are not covered with any insurance. And so that's another phase that we will be working with Dr. Talley and the team in Mississippi in regards to not only with us, but also getting our clients covered as well. Miss Linda?
Good afternoon. Can you hear me?
Yes.
Ooh, I can't believe I did it. Well, I too really appreciate the insurance, because I couldn't afford insurance. And my name is Linda Seals, and Dr. Lisa Buchanan, she came to me, she said, "You have insurance?" I said, "Can't afford it." She said, "Well, I need you to call Dr. Talley and get you some insurance." So I guess I was moving too slow. She came back by about 2 weeks. "Did you call Dr. Talley?" I said, "No, ma'am, but I'm gonna call her." And that's the best call I could have done, was actually call Dr. Talley, because Dr. Talley, truly, she's a warrior. Dr. Buchanan is definitely correct. She's not gonna get off that phone with you until you're satisfied, until she have did her job. Her navigation, oh, she's gonna do it. I did run into a problem in March of this year. One of the agents changed my insurance policy without my permission. And Dr. Talley, we got on that phone, and baby, we got it taken care of. Dr. Talley was right there in front of me. So I really appreciate it, because I tell you, it's something when you work every day and then can't afford insurance, then you get sick, you can't even afford to be off of work, because you can't afford to pay for, these office visits and your doctors and medicine. But I really thank Dr. Talley, and I thank Dr. Buchanan for even introducing me to Dr. Taylor. So Dr. Taylor, you keep up the good work and keep it up. And thank y'all so much. That's it.
Well, all right. I thank you all. I thought it was really something when Linda was talking, and bless her heart, an agent who didn't know anything about them somehow got into her policy and not only changed it and changed everything about it, and but we were able to get it done. And a second one tried to do the same thing, and so I guess individuals have to be very careful and to watch. But one of the things when I told you that we tell my clients to don't throw away your paperwork. Now keep your paperwork and keep your folder. And of course, Miss Linda had her folder, had her material there, and we were able to get everything straightened out. Well, I believe Duke, I believe we about past our time now, but and so anything else or any other questions someone may have, or can we do anything else?
Thanks for that, Dr. Talley. And I got to talk about Dr. Talley for a minute. She told me that she only wanted 5 minutes. She only wanted 5 minutes, and that she didn't have no presentation, and that she wasn't going to present long and all of that. But you did great, Dr. Talley. I just had to commend you on that.
Okay.
And Mr. Duke, Dr. Talley is an associate minister, pastor.
Yes, well.
With the three closings.
Is that right? That was your.
Thank y'all. Thanks, Team Jackson. Thanks, Dr. Buchanan and Ms. Seals, for coming on and sharing the testimony.
You're welcome.
And Dr. Taylor, give those office hours one more time so everybody knows.
Well, we are available, and the number is 601 662. What is it? 601. I'm sorry, 990-6896, and by appointment. We will go from 10 to 8 p.m. All right, then.
All right. Thank you, Dr. Talley.
You all have a blessed day now. And I guess everyone else, I want you to be as excited as we are about open enrollment and about the opportunity we have for health insurance.
Yes, we want everybody excited about today. Open enrollment.
Great presentation, Dr. Talley.
Well, I thank you. Bye-bye.
Bye-bye.
Let's see. I think we're going to go to Brother Campbell. I think you're up again.
Okay, we just have a little bit of information. Okay, so where is she? Trying to find Bettina. Okay. All right, so we're back again. And this slide that I have up here says Get Covered Mississippi. It says Get Covered Mississippi is a statewide faith-based coalition focused on raising public awareness and engaging consumers about health coverage options through the Affordable Care Act, Medicaid, CHIP, Medicare, federally qualified health centers, and we're promoting the importance of health and wellness.
Hello.
Hi, how are you?
Health insurance.
Just got off the phone with them today.
Right, so,
and how was your experience with them?
It was okay.
Real.
When I finally got them on the phone.
Oh,
Yeah,
were you able to get
returning my calls? And I was like, "What's the protocol for return
okay,
calls?"
we're working with the client right now, so
And she said,
just hold for just a
she had
second.
got to me and she said it takes 30 to 45 days for a decision. I was like, "Oh, it's a long time." That's what I said.
You were talking to the marketplace?
Okay, Sparkle.
Oh, okay.
That's
And did they get you signed up?
She said she was gonna look into it, but it can take 30 to 45 days for a decision. That's what she said. I was like, that's a long time. For people who need help, and then step away.
Okay, I'm back. Bettina's off working with the consumer that just popped in. One of the things I wanted to emphasize is we're here at the South Haven Library. We're just a little bit south of State Line Road, which is at the northern tip of Mississippi. You just finished hearing from Dr. Marion Talley, who is in Jackson, kind of midway down through the state. And before Dr. Talley spoke, we had Jane Nguyen, BPS SOS boat people down on the Gulf Coast here in Mississippi. So Get Covered Mississippi indeed covers entire state of Mississippi from the top to the bottom. Our first job with Get Covered Mississippi is we're trying to get people qualified for the Affordable Care Act coverage. And when you submit an application for Affordable Care Act coverage, marketplace coverage, based off of information that you put in about the members on the application, this application can also be used to determine eligibility for Medicaid or CHIP or for Medicare. And so it's our goal to get everybody covered through either ACA, Medicaid, CHIP, or Medicare. But unfortunately, there's going to be times when people don't qualify for coverage through any of those plans. And in that case, what our job becomes is we want to get you connected with one of the federally qualified health centers here in Mississippi. In the state of Mississippi, there are 343 federally qualified health centers. And again, these go from the top of the state down to the coast, the Gulf Coast. The federally qualified health centers provide quality health services for consumers, individuals, and then they also operate off of a sliding scale and based on your ability to pay. The federally qualified health centers are also excellent primary care facilities for you. So quite often, if you have a plan that's HMO, you need a primary care physician to make referrals to specialists or whatnot. And so the qualified health centers can serve as that primary care physician for you. And again, the number to call for help is 662-298-3584, or you can text us at 662-689-9712. Since we have locations throughout the state, calling or texting that number will enable you to be able to get placed with somebody that's within probably a few miles of your geographic area where you're located. Then there's also something called the Find Local Help tool. If you chose to go to healthcare.gov, you could use that particular link to find help within the state of Mississippi or any other state where you may be in. Okay. Bettina, anything to add before we leave?
I'm not sure what you covered, but I just wanted to say that our motto is coverage to care. And that means that we're going to work with you to try to get you insurance, to you and your family. But if for some reason you don't qualify and we're unable to get you qualified, then we want you to know that we don't just dismiss you. We work with you to make sure that you do get the care that you need. And sometimes that means that I'm up working long hours to try to make sure that we get you into the right, I should say, appropriate care for you through the federally qualified health centers. And we have a wonderful relationship with them, and I want to just give them a shout out because they have done a wonderful job in working with us to make sure that you have the care that you need. Or even sometimes some of the centers may not have specialists there, but they have worked with us and worked with the consumer to make sure that we get the right specialist for the consumer. So again, coverage to care. It's not just a job for us, but it's a ministry of love. So if you have questions, are you concerned? Are you want to sign up? Again, we're at the South Haven Library. Come on by.
Hey, thank you.
Thanks again, Brother Campbell and Sister Campbell. It's like every time we catch you guys, someone stopping by. I just love to see that someone is stopping by just to ask about the different how you can assist them. Also, in our chat, we discovered that someone who was listening to the telethon on Facebook inboxed one of our navigators about reapplying for Medicaid, and an application was completed with her consent. So, kudos to that. Kudos to Ms. Bogle for getting that application in. If any other navigator on the call has signed someone up for Affordable Care Act or Medicaid, please drop it in the chat and we will share about it more during this telethon.
All right.
Yes, I see we have a hand raised. Ms. Hill, do you have something you would like to share? Just unmute your mic. All right, well, we're going to turn it over to time for Ms. Abigail Means to come up to speak about the Affordable Care Act and open enrollment. Ms. Means, you could take it away. You're on mute.
We're cheerleading for open enrollment. I have Miss Melissa Vasquez with me as well, and she's going to translate the words that I say. Okay, good afternoon, everyone. I am Abigail Means. I am a assistant navigator for Oak Hill Regional Community Development Corporation. I am part of Team North Mississippi. We began partnering, Institute of Community Services began partnering with Oak Hill during COVID of December of 2020. I began working with the program on February 6, 2021. Oak Hill Regional CDC was and still is a blessing to Head Start families and our communities, because everything was shut down and our partners were not able to come to our buildings until August of 2022. ICS Head Start serves 14 counties, and they are Benton, Panola, Clay, Tate, Lowndes, DeSoto, Marshall, Tallahatchie, Grenada, Lafayette, Noxubee, Tippecanoe, Quitman, and Tunica County. With Oak Hill, we can offer Head Start parents, Medicaid, CHIP, and now the Affordable Care Act, Affordable Care, since November the 1st has kicked in today. We kick off our enrollment today. We are looking forward to offering health insurance to our families and our parents. We share information and communicate with our parents by Remind 101. That's our way of communicating through the center director. This year, Dr. Minor had a meeting with the center directors, and his vision was for this local community faith-based leaders to partner with Head Start. And they also added Dr. Westbrook as the liaison person for that. Flyers will be passed out during those meetings, and the meetings turned out excellent. Our last meeting was yesterday, and we had a great time. Several Head Start navigators have been contacting consumers through the Marketplace Assistant community. The Marketplace Place is a wonderful, it's wonderful that you can find health options that meet the consumer. I'm sorry for the inconvenience that I might have caused. Anyway, I was telling you about several of our Head Start navigators have been contacting consumers through Marketplace Assistant community. The Marketplace is a wonderful place that you can find health options to meet the consumer needs and find for their budgets. Some of the consumers are really appreciative when they are contacted. I emailed one consumer because I had no other way of communicating with her except for by email. And luckily, she called me back. She has 3 children that didn't lose their Medicaid, but she did. She lost her Medicaid. So we're in the process of assisting her to get back on Medicaid. The program itself is a blessing to everyone, and we, Oak Hill, really want healthy communities and healthy families. We also attend events in order to reach out to everyone in the community. Again, my name is Abigail Means. I am an assistant navigator, and I'm available to help families enroll in insurance. Again, the apparently something is, I'm sorry for the, for the inconvenience again. Again, the magic number is 662-298-3584. That you can contact that number, or else you can text at 662-689-9712. And if you sign up for coverage by December the 15th, you can begin coverage by January 1. So now I'm going to turn it over to my translator so she can reach out to our Hispanic and our Latino community.
Bienvenidos a todos a la presentación de OQ. El desarrollo comunitario regional de OQ comenzó a asociarse con el Instituto de Servicios Comunitarios, así es, Head Start Educación Temprano, durante la pandemia de COVID-19 en diciembre de 2020. La señora Abigail Means comenzó a trabajar con el programa el día 6 de febrero del año 2021. La Cooperación Regional de Desarrollo Comunitario de Oak Hill es una bendición para las familias y comunidades Head Start Educación Temprano y las que servimos y en cuando no pudimos regresar a nuestros centros hasta agosto de 2022. Así es, esta educación temprana sirví a los condados de Benton, Panola, Clay, Tate, Lowndes, De Soto, Marshall, Tallahatchie, Grenada, Lafayette, Noxubee, Activities Equipment y el condado Tunica en el estado de Mississippi. Con Oak Hill podamos ofrecer a las familias de Head Start renovar su Medicaid, CHIP, que es un programa de seguro para los niños, o inscribirse a uno de los planes de la ley de cuidado de salud a bajo precio, que es Affordable Care Act. Hoy iniciamos la inscripción abierta y esperamos ofrecer seguro médico a las familias. Compartimos información y nos comunicamos con nuestros padres a través del app o aplicación Remind 101. Lo siento por los problemas técnicos. Este año, el doctor Michael Minor, Dr. Michael Minor, con Oak Hill, tuvo una reunión con los directores del centro, en la oficina principal, así es, y agregó al pastor Westbrook al equipo de Oak Hill para que los centros Head Start Educación Temprano sean adaptados por líderes en la fe en la comunidad de la comunidad. El 22 centros de Head Start, que es educación, es un programa de educación temprano para familias, para infantes, por bebés y por niños de edad preescolar. Tuvimos reuniones Okay, I think we're back. Okay. En 22 centros de Head Start tuvimos reuniones que fueron muy exitosos. Se repartieron volantes o flyers de anuncio que se colocaron grandes carteles en cada centro. Los diversos navegadores han estado contactados en los consumidores a través de la comunidad de asistencia del mercado. El mercado es maravilloso.
So, lo siento por los problemas técnicos otra vez. Ok, el mercado es maravilloso en el sentido de que puede encontrar opciones de salud que satisfiquen las necesidades del consumidor y ajusten a sus presupuestos individuales. Envío un correo electrónico a un consumidor y me mostraron muy agradecidos cuando nos pusimos en contacto para ayudarle porque estaba discapacitada y había perdido su mente. Ella tiene 3 hijos y dijo que no podía pagar por sus medicamentos. El programa es una bendición para todos en Oak Hill. Realmente queremos ayudar miembros y familias saludables de la comunidad. La señora Abigail Mix, navegadora, está disponible para ayudarles a todos. A las familias a inscribirse en el seguro. El número de ella es 662-298-3584. Si se inscribe en la cobertura antes del día 15 de diciembre de 2023, su cobertura va a empezar el día 1 de enero de 2024. Muchas gracias por su tiempo. Sorry for the technical difficulties. I don't know who. If we're complete, turn it back over to our headquarters in Orlando, Mississippi.
Thank you so much, Ms. Abigail. And what was I didn't get your Ms. Vasquez. That's the translator's name?
Her name is Melissa Vasquez. She's the translator for ICS Head Start.
Thank you guys so much. Thank you.
I hate that it kept going out. I don't know what was going on.
All right, now we're going to turn it over to another navigator. And I believe, I hope I can get this right. If I get it right, Dr. Coburn is in Louisville?
Correct.
Okay,
Yes.
Louisville. All right, Dr. Coburn, it's on you.
Good afternoon, everyone. Get covered, Mississippi. My name is Dr. Cornelia Coburn, and I'm one of the 70 navigators that are located throughout the state. I happen to be located in Louisville, Mississippi, which is Winston County. We're located between Artibia County and Neshoba County. And I am working with Oak Hill Regional. And we would ask you all to let us help you go through the process of getting covered, Mississippi. We are here. Our phone number is 662-298-3584, 662-298-3584. You can text us at 662-689-9712. You can text us at 662-689-9712, or you can reach us at www.getcoveredmississippi.org. We also have an app. There's an app for that. It is open enrollment period, and we are ready to help you. We're open enrollment is from the 1st, today, November the 1st, throughout January the 16th. If you call and get enrolled before December the 15th, your coverage can start in January. After that date, your coverage will not start until February. I wanted to go over some of the things. It's already been mentioned about the essential things that the insurance covers, such as ambulatory services and emergency services. But one of the things that a lot of people I have learned as a nurse, the 20, 30, and 40 years old, they say, well, I don't get sick. I feel fine. I don't have to. But we know that there are health things that come upon us that we are not aware of. We have silent killers, such as hypertension and diabetes. So through the preventive health care services and affordable health care, there are chronic diseases and management that you can receive through those. And there are screenings that you can get to be sure that you really are in the health that you think you are healthy. One of those screenings is for blood pressure screening. We know blood pressure is a silent killer, so you may feel fine, but you don't know exactly how your blood pressure is until you get it screened. And through affordable healthcare, you can get the blood pressure screening, cholesterol screening. We know that this time colorectal cancer is high within the African American races. You can get those screenings for adults between the ages of 45 to 75. Depression screenings. We're a lot of press. We're under a lot of pressure and stress, and some people on their jobs and some want jobs. So you can get that screening through affordable healthcare. That's one of the free things you can screen for. Also, diabetes type 2. Those screenings are for adults 40 to 70 years old. Those also you can get diet counseling, and if you're high risk for chronic diseases such as hypertension and diabetes or cholesterol. You can also get screenings for hepatitis B and hepatitis C. You can get screening for HIV. We know that's at a high rate at this time. You can get all your shots. You can get your chickenpox shot, your diphtheria shot, your flu shots. And we know flu season is in, and pneumonia. A lot of people have pneumonia at this time. You can get those shots through. And the shingles, you can get your tetanus shot. You can get lung cancer screenings for adults 50 to 80 years old. You can also get obesity screening and counseling. We know that being overweight can cause a lot of problems when we have our chronic diseases. So this is one of the screenings you can get through affordable healthcare. We at Oak Hill Regional would like to help you sign up for your affordable healthcare. Again, our number is 662-298-3584. You can text us at 662-698-9712. And I am available here in Winston County. My time that I'll be available is 10 to 4 p.m. on Monday, Tuesday, Wednesdays, and Thursdays. That's virtually. If you'd like to meet me at Winston County Library, I will be there on Tuesday, Wednesdays, and Thursdays from 11 to 2 p.m. Again, we at Oak Hill Regional would like to help you go through the process of getting your affordable health care. You might want to update your plan. You might like the plan you have, but you may want to compare it with some other plans. Again, our number is 662-298-3584. And you can text us at 662-689-9712. Check us out on www.getcoveredmississippi.org or get our app. You might want to show your friends or some of your relatives one of the things that they can go through on that. They go to our app. You'll be able to walk yourself right through all the processes. You'll see the things that are available to you. We also have, we can refer you out to FHQCs. We have one here in Winston County. There are 225 throughout the state. So give us a chance to help you at Oak Hill Regional, 662-298-3584, 662-689-9712. You can text us. Back to you, Duke.
Thank you so much, Dr. Coburn. And I have to get on her too. She was another one that said that she didn't have the link to talk, but she did such an amazing job.
Hello, we're Team Mid-Delta located in Washington County, Mississippi. We're here today to discuss the Affordable Care Act. I'm Jacqueline Moore.
I'm Jacqueline Carroll. I'm Beverly Courtney. And I'm Vanessa Jackson.
The Affordable Care Act, also known as Obamacare, was created to help the million of Americans who were uninsured for medical service. With the cost of rising medical services in our country, it is necessary that every individual have insurance. Not just any insurance, but one that offers 10 essential benefits. Ms. Courtney?
Some benefits: ambulatory outpatient services, emergency services, hospitalization, pregnancy, maternity, and newborn care.
And also mental health, substance disorder services, prescription drugs, rehabilitative and habilitative services and devices, and laboratory services.
Also preventive and wellness and chronic disease management, pediatric services, including oral and vision care, but adult dental and vision coverage are essential health benefits.
We are certified navigators here to help you with your health care needs. Please contact us at 931-0550.
Let's recover Mississippi.
Let's go.
Can you tell me how to apply for Medicaid CHIP and how to sign up if I still qualify?
Just go to Medicaid.
Turn your mic on, Kat.
Go to Medicaid.
Go to Medicaid.gov.
Go to Medicaid.gov to apply.
To reapply. Or visit Medicaid or CHIP. Can you apply anytime?
Can I do what? I can't hear you.
I can't hear you. Anytime.
Yeah, anytime, 24 hours.
Anytime? Yeah, anytime.
Is that right?
24 hours. And it's not limited to the number of times you can apply. Is that right?
Yeah.
And it's no
Well,
limited
no,
on
numbers don't have no end, so I guess I don't know. You tell me.
You tell me. So you saying it's infinite? Yeah, there's a time limit where you can apply. Right now, it's open from November 1st until we got one extra day, January 16th, from November 1st today, so from November 1st today until January 5th. And then under certain circumstances you can apply special enrollment. If there's a change of status, or job change, or some other things that change in their life, you may be eligible for special enrollment.
Y'all keep talking about all this change. What else you got for? Because I know everything about insurance. Everything.
Well, the next question is yours.
Everything.
Bring it.
Prescription drugs, emergency care, mental health care. Is that part of the plan?
Now, what the doctor doing at the marketplace ain't got nothing but fruits and vegetables like that. You tell me. You know more than I do. You tell me.
You know more than I do.
No. What did you say about the marketplace?
What did you tell us about the marketplace? What did you tell us about the marketplace? What did you tell us about the marketplace?
Well, I'm gonna let Sister Albright do it. She got to pay.
Well, I'm gonna let Sister Albright do it. She got to pay. Well, we have to let you know that the marketplace does cover the doctor's visits, your prescription drugs, emergency care, your mental health, your hospitalization, and much more. It depends on your plan, and when you sign up, you can find out what allows you to.
Here we go with that budget again. Budget. That's all I hear. Budget. What else you got to say? I'm just listening now.
Kathy, you may be able to sign up for Medicare without paying a late enrollment penalty. Is that correct?
Well, yes.
Most people if you know you qualify for Medicare,
but you don't sign up for it when you become eligible. You have a limited time to
eligible.
talk about
You have
special
limited time
when it starts.
So we talk about special enrollment period, right? And when
to sign up
for Medicare during the special enrollment period, you fill out all forms and mail them in to Social Security office.
And for more information, you can contact.
And for more information, you can contact Medicare.
With all the navigators y'all got.
Can anybody navigate in the country? Or
do I have to be in a certain
state? If you live in the state of Mississippi, you will have to use the Mississippi Navigator. You cannot cross the line. We have to stay within our range. We have multiple navigators across all the counties. So, here's what I want you guys to remember this. You need help applying or renewing for your Medicaid or your health coverage. You can call us at 662-298-3584, or you can text us at 662-689-9712. I am Phyllis Albright. I am a navigator and also the Mid-South the General Secretary of the Mid-South Church.
That's a lot to remember. Let me ask you one thing. What was your number? I can call you. Give me that number.
The number is 662-298-3584.
And you should give him your personal number. He can call you on your cell, right?
Right. You can reach me by cell at 901-358-3553.
And you can call me at 901-239. And you can call me at 901-239-3237.
Well, I personally thank you navigators for trying to help me. Now, when I pull this fire truck up there, I want someone to be able to assist me there. Now, you gave me your cell numbers. Now, can I come to the facility or your headquarters as well?
Yes, you can. And it doesn't matter how you come. From your fire truck, you can walk, drive, just get here and get covered. And we're located at 1775 Memphis Street, Fernando, Mississippi, 38636. We welcome you all at all times. We welcome you all at all times. Monday we're here from 9 to 5. Monday and Wednesday we're here from 9 to 5. Thursday we're here from 9 to 7. And on Thursday we're here from 9 to 7. And on Friday we're here from 9 to 5.
I understand how to get the water hose off the truck and put out a fire. But I don't understand all that stuff about insurance. Can I bring somebody on to help me with that insurance? Well, can I ask one of y'all to pick a plan for me?
Can I ask one of y'all to pick a plan? No, we don't pick plans. We just give you the information.
Now, it's a lot of stuff out there. How much commission do y'all make on
plan?
You do this work and there's no commission?
No.
Now,
you do this work and there's no commission?
well, I sure think y'all ain't gonna charge me. You're just gonna educate me about insurance, and I need insurance. So thank you so very much. I'll be down there as soon as I'll show up. If I can't make it, I'll call and set me an appointment up on Saturday, unless we got to fight a fight.
Please come. We will be here too. We look forward to seeing you.
Thank you so much. Thank you so much.
Thank you so much.
All right, I think we're back to Brother Campbell. Still with us?
Okay, yeah, come on. Okay, so here I am back again, still at the library for a little while longer. And I think about all that we really need to say now is that we have office hours at our regional headquarters office, 1775 Memphis Street in Hernando, Mississippi. The hours should be viewable on the screen here. Essentially, they're 9 a.m. to 5 p.m., with the exception of Wednesday and Thursday when we're open till 7 p.m. And then on Saturdays, we close at 1 p.m. And so you can call us at 662-298-3584. Text us 662-689-9712. And somebody will be more than happy to get you in touch with a navigator who can take care of your health care coverage needs for you. Bettina, anything else you'd like to say? Oh, Bettina has said it all. So I'd like to thank everybody for tuning in and listening to our presentations today. And we hope to hear from you. Goodbye.
Do you know what today is? Today is the first day of open enrollment for the Affordable Care Act. That's right, the first day. We encourage each of you to contact Oak Hill Regional CDC Get Covered Mississippi for marketplace assistance. They would love to have a conversation with you and make sure that you get covered. Call the office at 662-298-3584. That's 662-298-3584. Or visit the website at getcoveredmississippi.org. Get covered.
Guess what day it is? Today is ACA Open Enrollment. Open Enrollment goes from November 1st to January 15th, 2024. Sign up for ACA to stay healthy today. Give the office a call at 662-298-3584 or text us at 662-689-9712. Get covered, Mississippi.
It's open enrollment, November 1st, 2023. And I bring you greetings from the Mid-South Church's Cooperative Conference State Baptist Convention, where Dr. Michael O'Miner is our president, Bernard Montgomery is our vice president at large, and Phyllistina Albrighton is our general secretary. I am Loretta Miller, I'm a navigator, and I'm ready to assist. Simply come by our location or give us a call, 662-298-3584, where we can assist with your application process, answer questions should you desire. Or you can simply go to www.healthcare.gov to begin your process. Yes, today is open enrollment. This is open enrollment number 11, and it will be available for you until January 15th, 2023. If you want your insurance to begin in January, on the first day of January, you will need to have your premium paid by the middle of December, December 15th. However, should you decide to have insurance by February 1st, you only need to have a plan selected and paid by January 15th. There are some other specifications that you might need to know about. When you visit www.healthcare.gov, you can go in, complete your application, put in the number of people in your household, your income, your location, and choose plans. Or you can just window shop. Go in, select your location, where you are, your zip code, city, state, and then you can just window shop. You can compare plans. You can see which plan has your doctors, your very specific, such as your specialist, if you need one. But the option is yours, www.healthcare.gov. If you need assistance, give us a call, 662-298-3584. Otherwise, the plan and the website is open 24 hours a day for you to take your time and select the plan just for you and your family. It's all based on income, so you might want to put your information in and determine whether you have qualified for APTC, a approved advanced payment tax credit, or look for some of the other cost reduction savings that are available for you on the marketplace. And again, if you need assistance, give us a call, 662-298-3584. We are ready, available, and willing to help. Thank you, and look forward to either seeing you, talking to you, or just having fun during this open enrollment period. Thanks.
are so excited here at the Hernandez Head Start. I know we have had this telethon all day. We're going to close it out with this Hernandez Head Start. They're going to tell you what open enrollment is. Open enrollment, this is our 11th open enrollment marketplace, but they have something to tell each and every one of us. Let's go. Sign up for ACA. Marketplace. This is our 11th year. We just want to let you know this is the time to sign up from November the 1st to January the 15th. November the 1st, January 15th. Stay healthy. Woo!
Hi, everybody. Hello. Good afternoon. Good afternoon. Happy Wednesday to you. I am so excited that November 1st has finally gotten here. I am Lottie Miner. I'm the project director for Oak Hill Regional Community Development Corporation, Get Covered, Mississippi. And y'all, this is my 11th year of doing this. And I am elated to have another opportunity to help Mississippians get insurance. You know, this is important to me personally, not just because this is what I do every day, but it's important for me because I like to see people healthy. I have seen too many people lose their livelihood because of the lack of insurance. And I'll use myself for an example. As a college student, many moons ago, I had no health insurance for a very short period. And I got pretty sick. It was during midterm exams, and my mom and my auntie took me to the hospital, and we had a huge medical bill. And it was years later when I was an adult and I really understood what money was and the importance of balancing money and having insurance, when I learned how long my mom stayed on a payment plan to pay off that debt. That was because of the lack of insurance. But she ensured the best she could that I got taken care of. Now, parents don't have to do that because there is an opportunity either through Medicaid and CHIP or through the Affordable Care Act. So that's one of the reasons that I am so excited every year about open enrollment and about giving families the opportunity to get health care coverage. I remember somebody way back in the day that got turned away from a local hospital because they were considered indigent care. They did not have insurance and they did not have money to pay to be seen. Now, because of the Affordable Care Act, people cannot be turned away from any hospital at all. They have to be seen to get at least stabilized, and then they can make a decision then about how they want to proceed with their health care. So guys, insurance is so important. We think about so many other things in life. We get consumed with work, we get consumed with school, we get consumed with this, that, and the other, and all those things are important. But if we don't have our health, we can't enjoy any of those things. Our health is worth more than $1 million. So it's important. Please come and see us. Our headquarters is at 1775 Memphis Street in the beautiful metropolis of Hernando, Mississippi. I call it God's country. We are available all across the state. You've met so many of our team members already today. And guys, we are willing, ready, and able to assist you. And let's say perhaps you come and see one of us, and maybe Marketplace ACA coverage is not for you for whatever reason. Other options are Medicaid and CHIP for those who qualify. And then, of course, there's some folks who don't fit into either of those categories, and we can refer you to a fairly qualified community health center. And I'm going to be real honest. 11 years ago, the first time I heard of a federally qualified community health center, my first question was, is that the health department? I'm not going to send people who are gainfully employed to the health department. That was my answer. And I answered out of ignorance. But then I later learned that federally qualified community health centers are very, very capable providers, doctors' offices, and you've heard them talked about today already on this telethon, that can provide the whole gamut of services, and the charges are on a sliding scale. So anybody can go there, from the richest to the poorest, whether you have insurance or not. Those are facilities that are available to help you get the medical care that you need. They can even do referrals if you need a referral. So there are many, many options for health care. Guys, I love Mississippi. I don't want us to be the most unhealthy state. I want us to do better. And we, Get Covered Mississippi, are here every single day to help us do better, to help you do better, to ensure that we have insurance. And you say, well, I'm healthy. Well, that's great. You want to stay healthy. Get your wellness exams, your annual physicals. They are totally free because of the Affordable Care Act. So please, ma'am, please, sir, I hope you will heed our advice. We have enjoyed doing this telethon. It has been a lot of fun. I really meant to have some music playing and dance around, but that didn't work out. But I hope my words are reaching you. I hope that you're hearing the words that are coming out of my mouth, and that you know how sincere and how serious we are about the health care of Mississippians. All right, folks, I am excited. It is November 1st. I am ready to roll. We have computers, and we will sign you up. You don't even have to have an appointment. You can walk in during the hours that we're open, and we have a cadre of skilled people who will assist you in getting this done. Don't use the ER for your doctor's office anymore. Don't omit your wellness exams. Don't forget to come and see us. All right. Thank you. You did all the way.
It's that time again. Open enrollment. You got to get it moving.
Open enrollment begins today, November the 1st. Today, and it goes through January the 15th. This is a very big day for us. Indeed. We are here to help. Oak Hill has certified navigators ready to assist you with getting any kind of coverage that you may need. If you don't qualify for the Affordable Care Act insurance, we can even refer you to a federally qualified community health care center. We just need you to call us so that you can get your coverage or whatever needs met that you need.
Or questions answered.
Healthcare coverage is so important.
Mentally and physically. We have a great need, especially here in Mississippi.
Especially in Mississippi. We want you to contact us, reach out to us, whatever you need. If you sign up for coverage by December 15th, your coverage can start as early as January 1st. If you complete your application for coverage after December 15th, your coverage can start on February 1st, 2024.
Yes, indeed. And if you need that assistance, you can dial 662-298-3584. Again, that's 662-298-3584. Someone is going to answer. We're going to help you. We're going to push through. This is our telethon. We're going to make sure everybody in Mississippi can hear us and get covered because we need this. We have every opportunity that's given to us right here, right now. Let's take advantage of it. Open enrollment. Let's go!
Good morning. My name is Chandra, and this here is my son Jamari, and we're here today to tell you guys how important it is to stay up to date on your health and your dental, and make sure that you stay coverage on your Medicare and Medicaid, whichever one you need. Healthcare is important for everyone. If you don't have it, then please enroll. Open enrollment coverage starts November 1st and ends January 5th. Thank you. 15th. Thank you.
Good morning, my name is Emery and this is my daughter Zuri, and I just want to speak on how it's very important to get coverage, whether it's the Medicaid chip or the marketplace coverage. Keeping your coverage is very important, as me being a pregnant mom with twins and having my daughter Zuri. It's very important. It's very important. It helps the peace of mind and knowing that I'm covered through with Medicaid. I don't have to worry about my medical bills or anything. And it's very encouraging with the signs being everywhere with Oakview to remind everyone, Oak Hill, to remind everyone to stay covered and keep coverage. And open enrollment starts November 1st and it ends January 15th.
Thank you.
Thank you.
Go.
Hello, my name is Bionica. I would like to thank Oak Hill, Get Covered Mississippi, and Healthy Kids of Mississippi for helping me obtain medical coverage for me and my children. When I lost my job, they were out in the community in multiple events, and I decided to stop and talk to one, and they got me covered right away. They also helped me with resources in the community and helped me find doctor's offices for me and my children and certain specialists. So thank you, Oak Hill, Get Covered Mississippi, and Mississippi Healthy Kids of Mississippi.
I'm the center director here at the Mary Cathy Head Start Center. I've been with ICS for many years, and I've seen a lot of parents that needed health care coverage. And I'm talking about the open enrollment. We have been November the 1st today up until January the 15th. And if you need this coverage, it's very important. We need you to participate in this open enrollment. If you need any assistance, we need you to contact Oak Hill at 662-298-3584. Open enrollment.
Good morning, good morning, good morning. We are so excited. Today begins the open enrollment for the Affordable Care Act, also known as ACA. One might ask, what is ACA? What is that lady talking about? Well, ACA is the Comprehensive Healthcare Reform Law enacted in March 2010. The law makes health insurance available to more people. Open enrollment starts today, November 1st through January 15th, and we are here to assist you. You can contact us at 662-298-3584. And I have with me Ms. Nettie Brazel, Ms. Linda Lee, and also Ms. Candy Shiga. And Ms. Nettie Brazel, she will tell us more about what the ACA, what are the primary goals of the Affordable Care Act.
The law has three primary goals. Make affordable health insurance available to more people. The law provides consumers with subsidies that lower costs for households with incomes between 100% and 400% of the federal poverty level. Expand the Medicaid program. And 3, support innovative medical care delivery methods designed to lower the cost of health care generally.
Good morning. I will talk about the programs and service. Under the Affordable Care Act, Health and Human Service administer more than 100 programs across its operating division. Health and Human Service program protect the health of all Americans and provide essential human services, especially for those who are least able to help themselves. To name a few: social services, prevention and wellness, education and training opportunities, complaints and appeals, public health safety, emergency preparedness and response, research, and providers and facilities, just to name a few.
The Affordable Care Act is not limited just to medical. Dental and vision plans are also available. Mental behavioral health are essential health benefits that are also covered. Health insurance companies will not refuse to cover or charge you more for pre-existing health conditions. And with the new law, 4 out of 5 customers can find a plan for $10 or less per month with assistance.
So don't forget, we are all assisters with Oak Hill Regional RCDC, and we are here to assist each and every one of us. You can contact us again at 662-298-3584. Thank you.
I think I need health insurance. Where can I go to get insured? Who can help me get covered? Is it too late? Can someone help me? Come on in. Let's get you covered. Can you help me get insured? What do I need to bring? Can my family get covered? Yes, I can help you. Bring income info, SS number, and household dependent info. Let's set you up. If you need help also, give us a call at 662-983-584.
Me llamo Mario con Get Covered Mississippi. Yo soy un navigator para ACA y Open Enrollment se empieza hoy, 1 de noviembre. ¿Todavía tienes seguro médico? Si no, esta es oportunidad para obtener un seguro médico para ti y tu familia. Si estás en el DeSoto County, ven a nuestra oficina a 1775 Memphis Street, Hernando, Mississippi. El número es 662-298-3584. Open Enrollment termina el 15 de enero, entonces obtenga cobertura hoy.
Hello, we're Team Mid-Delta located in Washington County, Mississippi. We're here today to discuss the Affordable Care Act. I'm Jacqueline Moore.
I'm Jacqueline Carroll.
I'm Beverly Courtney.
And I'm Vanessa Jackson.
The Affordable Care Act, also known as Obamacare, was created to help the millions of Americans who were uninsured for medical service. With the cost of rising medical services in our country, it is necessary that every individual have insurance. Not just any insurance, but one that offers 10 essential benefits. Ms. Courtney?
Some benefits: ambulatory outpatient services, emergency services, hospitalization, pregnancy, maternity, and newborn care.
And also mental health substance disorder services, prescription drugs, rehabilitative and habilitative services and devices, and laboratory services. Also preventive and wellness and chronic disease management, pediatric services including oral and vision care, but adult dental and vision coverage are essential health benefits.
We are certified navigators here to help you with your health care needs. Please contact us at 662-931-0550. Let's get covered, Mississippi.
Hello, my name is Lori Rogers. I am an assistant navigator with Oak Hill Regional CDC, and we are live at Enchanted Days Learning Center Trunk or Treat.
And I'm Alice Jackson. I'm also an assistant navigator for Oak Hill Regional CDC.
ICS Head Start partnered with Oak Hill Regional CDC back in February of 2021, where we both became assisters. And what we do is we assist children and families with Medicaid and CHIP. We begin by gathering information on our families as well as people in the community so we can assist them with recertification for their Medicaid and CHIP. In September of 2021, we all moved from being just assisters to navigators for the marketplace or affordable healthcare health insurance.
I'm excited to announce that open enrollment begins November 1st, and we are ready to serve as many families in our communities as possible. Our goal is to assist the entire family with getting coverage and renewing coverage. We are willing to assist with them with however that we can to make sure that they are covered with medical insurance, health insurance.
So today we want to say Get Covered Mississippi. You can reach us at our headquarters is located in Hernando, Mississippi, 1775 Memphis Street, Hernando, Mississippi. And our phone number is 662-298-3584. Get Covered Mississippi.
I got a health plan not knowing that I was going to need it 3 months later. For $17 a month, my plan includes counseling, and it completely changed my life.
I'm not on my parents' health insurance anymore, so I found a plan for just $34 a month.
Signing up was so easy, it only took me 30 minutes to find a plan for $13 a month.
All plans cover doctor visits, prescriptions, emergency care, and more. Healthcare.gov is here for you. Enroll by December 15th.
I'm not on my parents' health insurance anymore, and I work for myself doing a bit of everything, so I found a plan for just $34 a month.
All plans cover doctor visits, prescriptions, emergency care, and more. Healthcare.gov is here for you. Enroll by December 15th.
I got a health plan not knowing that I was going to need it 3 months later. Last year, we had a pretty significant loss in our family, and I knew I needed professional help. Having access to being able to go to a therapist made me better. For $17 a month, my plan includes counseling, and it completely changed my life.
All plans cover doctor visits, prescriptions, emergency care, and more. Healthcare.gov is here for you. Enroll by December 15th.
For $17 a month,
Lights are shining bright. My friends are in the club. We'll go all night. I see you in the back. The mood is right. If I just had your number, I would let you know how I feel. You walk up to me, start dancing to the music, energies like this was meant to be. Take my hand, I feel my heart beat, and I don't want this moment to stop. Time to go home. Don't want this night to end. Yeah, about time we stop pretending. Come home with me. Let's write a history. Tonight I'll make you see. It's all about us. It's all about us. As we're dancing close together, making
My name is Ethel Hill, and I work for Oak Hill. I'm one of the navigators, and I work for Sunflower County, Oliver County, LaFleur County, Sussex County, and I just love being a navigator for Oak Hill. And open enrollment will become November the 1st. Open enrollment is January. And we're excited about it, and we're here today with Wellness Fair, and we're just enjoying our day.
Hi, my name is Mary Pound. I'm a navigator with Oak Hill Regional also, and I enjoy working with the residents of the state of Mississippi, especially in the Sunflower County, Sussex County, LaFleur County, Bolivar County area. We're excited about this open enrollment period from November 1st, 2023 to January 15th of 2024. Get covered, Mississippi! And we're here today, get covered for Mississippi. We're here live in Sunflower, Mississippi, at a health and wellness fair at the Seminole Missionary Baptist Church. And we're excited about getting Mississippians covered.
We are winding down to the end of our webinar, our telethon for open enrollment. Coming to the last section. Ms. Taylor, would you like to share a few words? I put her on the spot. Okay, we'll come back to her in 1 second, but I do want to share with everybody about open enrollment again. It starts today and it ends January 16th. We've been saying January 15th. We've been saying January 15th all day, but you do have, since January 15th is a holiday, it goes all day January 16th, and then January 17th until 5 a.m. Eastern time. That's when you end. So you have all day January 15th and all day January 16th to take part in this Affordable Care Act. I also want to give a big shout out to the tech team for holding it down all day with me. They have done such an amazing job finding things to post and share. I wish I could bring them up on camera so you can tell who's behind the scenes. Ms. White, could you come up? You able to share your screen, your camera? Ms. White, Ms. Palmer. Let me add them as on spotlight. Ms. Sharonda, are you on here as well? Can you share your screen? Share your camera. Let's turn camera on. If not, I understand. But these people have helped out so much. They are such an amazing group of people to work with every single day. Thank you guys so much. And do you like to share? Would you like to say anything before I turn it over to Ms. Taylor?
Hi, my name is Tabitha White. I enjoy working with the entire Oak Hill team. I especially enjoy working with technology and metrics. I think everyone does an awesome job. All of the navigators, kudos to you. This was an awesome kickoff. Thank you all so much for everyone who shared and took time out to create a video. We enjoy every single moment. Thank you.
We enjoyed every single moment of it. Thanks, Ms. White, Ms. Palmer, Ms. Lee, for all your hard work. Ms. Taylor, would you like to add anything for this evening?
I just want to say just kudos to everyone. This has been a great day. I've been watching on and off, but once I got to the headquarters, I saw so many different things. You guys have done a marvelous job. Everybody just need to give yourself a hand clap because this is powerful. This is some great information. We've shared information all day about enrollment, open enrollment. This is so important because people just don't understand the importance of medical issues that's going on. And when you have people that's standing by to assist you with health insurance, you cannot ask for anything better. So continue to reach out to us. That number is 662-298-3584. We thank you all so much. Remember 662-298-3584. Woo! Let's go. Open enrollment. Kudos. Thank everyone for all your hard work. Keep doing what you're doing. And Head Start, thumbs up. You guys did a marvelous job. Everyone did a marvelous job. We thank you all for taking out all of that time to just take time out to do what you did today. We appreciate you. We appreciate you reaching out to your families and sharing all this great information. And we're here. We're at the headquarters 5 days a week, actually 6 days a week. So give us a call and we can assist you the best way we know how. Have a great day. Appreciate everyone. Open enrollment. Great job.
Thank you for that, Ms. Taylor. Also, have to talk about another person who's not a part of the tech team, but did such an amazing job on sending me videos. Miss Loretta Miller. She did such an amazing job. Ms. Miller, do you have anything you would like to say? If not, Ms. Miller, I really do appreciate it. Well, we are at our last 5 minute mark, and so going to turn it over to Ms. Jefferson to close. And once again, everybody, thanks for tuning in for this 2024 open enrollment kickoff telethon. We were here from 9 a.m. Well, we're really before 9 a.m. because Dr. Minor got started at 8:30. So we've been here all day. We took a slight break, but I hope you got all the information that you needed. And please give us a call or text us or visit our website, and we'll be more than happy to assist you. Ms. Jefferson, it's all on you.
All on me? Wow. I get to bring up the rear. What a wonderful day it has been. Open enrollment kickoff. We're looking forward to this open enrollment season. So you all come on out. Brother Campbell gave our office hours here at the headquarters, which is Monday, Tuesday, and Fridays from 9 to 5, Tuesday and Thursday from 9 to 7. And if you need us on the weekend, we are available. Just call 662-298-3584. We are ready and willing to serve you all. And if you need some information a little sooner than next week, we have a health fair Saturday where you can come out and get more information. And you can also come out and sign up. We will be here Saturday. I think it's from 10 to 1, 10 to 2, and we will be sure to assist you. And if we can't get you signed up, we will refer you to a qualified health center, federal qualified health center. But today has been a good day. There's been a lot of information shared, and we hope you took some notes. Just in case you didn't, it's been recorded. You can go back and listen to it all over again. See some of our hiccups and our laughter and all of our excitement. But just make sure you get this information. It is valuable information. This has been a full day of information. And we really do care about what we're doing. We love being of service to our communities, as they say, from the top of Mississippi all the way down to the bottom and everywhere in between. We want to get Mississippi covered. We want to get you covered one way or the other, whether it's through the marketplace or Medicaid or CHIP. We want you covered. We want you to have some kind of insurance, health insurance for you and your family. So now, Duke, I'm not going to talk for no 2 minutes. So now I'm not sure what you want me to do. If you want me to close us out in prayer, I can do that. But I see Sister Taylor laughing at me. But hey, this has been a long day, a long good day.
I was thinking, telling them that you were watching the clock. You were waiting till 5 o'clock. I knew it.
Well, okay, we got 1 more minute, but that's okay because I think it's been a day well spent. We had a lot of excitement from all of our Head Start centers, from our other collaborators, As I listened to Miss Tally, I know Duke was saying, she said she only needed 5 minutes, but
Only needed 5 minutes.
her friend there said that she was a preacher, so we could expect longer. But everything, the day has been well spent. So
Yes,
Duke,
and I think that we're 10 seconds.
get covered, get covered, get covered.
Get covered.
Get in the room.
Get covered.
Everybody's more than
We
welcome.
are ready.
Mute your mics now and say get covered. Everybody unmute their mics and say, let's say get covered, Mississippi.
Get covered, Mississippi.
Get covered,
Mississippi. Yay.
Get covered, Mississippi. Get covered, Mississippi.
Open enrollment.
Open enrollment. Starts today.
November 1st.
Yes, you heard it here. Get covered, Mississippi. And this concludes our telethon. I think we are going to close out in prayer, Sister Jefferson. You can go right ahead and close us out.
Okay. Lord, we come to you today telling you thank you. Thank you for such a wonderful day. Thank you for all of our navigators, our collaborators, our very qualified community health centers. Thank you for all those that has been listening, taking notes, ready to come and get covered. Lord, I ask that you touch each family that may need this service and touch us, Lord, to be good stewards, to be able to help these families get health care coverage. And we'll be careful to give you all the praises and the glory. And Lord, bless our leader, Dr. Minor, Sister Minor. Bless them, cover them, keep them, and give them what they need to give to us. Help us to be good to our Mississippians. Help us to serve them well. We love you, Lord, and we bless your holy name. In your darling son, Jesus' name. Amen.
Amen.
Amen. Have a good afternoon.
Y'all have a good evening.
Amen.
Go
Bye-bye.
home. Go eat, go eat, go eat, go.